This is a letter from the American Academy of Actuaries, which was sent to them in January of 2011, drawing their attention to the fact that when the state uses a consulting actuary, the actuary doesn't have to determine whether information provided by HMOs is false or misleading. It doesn't have to develop data compilations to look for false or misleading information, and it doesn't have to audit the data, which of course calls for the question, who does this? And the answer is no one does this. And that's why the legislation that was proposed in Minnesota to do this was so critically and urgently needed, and why it's shocking that it's been delayed for 3 years. What we have going on in Minnesota is nothing short of disaster. Whether your interest is in balancing the budget deficit and fiscal responsibility, or whether your interest is in getting health care to more people, the simple fact of the matter is that this is a multi-billion-dollar program in this state, and we can't account for a huge amount of slippage, someplace between 20 and 25% at a minimum. This is completely unacceptable, and as taxpayers, we should all be outraged. That's why I'm grateful for everyone who has rallied to this cause, who has taken the time to understand this issue, and who is interested in its further exploration. And it's my understanding that federal legislation will soon be introduced, which will remedy the problem which Minnesota's legislature was unable to adequately address. Thank you.
Are there any questions for David or myself? Carl, go ahead.
I read in this article on Minnesota State News, it said the problem's been going on for about 15 years. Can you elaborate on that a little bit?
We've been padding the federal tab. The problem of lack of accountability has probably been going on for 20 years. When we outsource these programs, one of the principal defects here that we have to acknowledge is, and both Governor Dayton and Commissioner Jessner said this, when they were asked about this, they said, we just did what the HMOs told us. And that's problematic, because you can outsource a government function, but you can't outsource the governance of that function. The elected officials must be in charge and manage these programs, and that disappeared more than 15 years ago. The current scheme that we're talking about seems to have been invented in 2003 when Minnesota was caught by the Office of Inspector General cost shifting, just passing on impermissible costs onto the federal tab. There was nothing clever or insidious about it. It was just dishonest, and we were caught, and we stopped. And it looks like in 2003 we invented this.
Other questions?
I'm curious as to, obviously, you're campaigning at this point.
Right.
Have you taken on your opponent within the party about this? And do you have concordance on this, or divergent views, or obviously he's been in the legislature?
Right. Well, the reason that I'm here is to support the work of David Feinlachs, and especially support his recommendation for an audit. I'm not here to be critical of anyone in particular in either party. However, let me clarify. What we are talking about clearly is a good government issue. It's a stewardship issue. It's a moral issue. It's a financial issue. It is also a political issue. And in my case, as many here know, the centerpiece of my congressional campaign is to deal constructively with the ballooning federal debt. And my platform is to balance the federal budget in 6 years or less. So in order to balance the budget in 6 years or less, obviously we need to make spending reductions. What I anticipate is that for 2013, we have to cut federal spending by something like $200 billion. So let's just have that in the background. And when I read the staff report, which I read about 10 days ago, and saw the number up to $100 billion being wasted on Medicaid waste, fraud, and abuse, I immediately plugged that into my platform. and recognize that of the 200 billion spending reduction that we need to make, we potentially have half of it in solving waste abuse and fraud. And when you can cut spending by that much without reducing programs and without raising taxes, then I am obligated to exert whatever influence I have to see to it that this problem is solved. And I would say I am obligated to do so. So 10 days ago, I had no intention of being here. But I read the staff report, then I read House File 2294, which clearly stated, made it clear that the state of Minnesota is not going to constructively deal with the issue. And there, if I had read that an immediate audit was being required, I would not have been here. So I am critical of all legislators and the governor for not having a bill requiring a timely, meaningful audit, but no one in particular. Other questions? Can't believe you're going to let David and myself off this easy. Especially David, you can let me off. I assure you, David can answer anything. Okay, yeah, sure, go ahead.
Will auditing this program cause it to go bankrupt? And do you have a solution for a different
Will it
kind?
make it drive the state bankrupt?
Yeah.
Well, let me give you my opinion on that, and then David really can answer it more authoritatively. But let me just state, first of all, that the state of Minnesota pays a good share of the Medicaid costs, and that varies, but it's 50%. It's 50% on down. So overcharging for Medicaid, money that's going to the HMOs, is also coming out of the state treasury. And so we don't know, David can correct me on this if he thinks I'm wrong, we don't know that the state of Minnesota is going to be out anything, and it might be ahead. But the HMOs are going to be out big time cash. We need an audit to find out about that. And I'm going to borrow David's analogy because it's so wonderful, and then David needs to speak more authoritatively. His analogy is this has been a Robin Hood sort of thing, where the poor state of Minnesota is robbing the rich federal government. The problem is that Robin Hood does not pass the money on to the poor. Robin Hood is keeping the cash. And we think that's unacceptable. That's his analogy, so I give him credit.
And that is exactly the analogy I would use. People who want to avoid scrutiny here have been making the arguments that will bankrupt the state. This has nothing to do with the state. This will not bankrupt the state. This money was misappropriated and given to these private, nonprofit corporations, and they're sitting on it. Providers, over the last 12 years, the costs of this program, as stated by the vendors, have increased 115%. Yet provider reimbursement is flat or declining. The difference is the money that's missing. And so, as Mr. Quist said, as I have said, if you steal from the rich to give to the poor, maybe you're Robin, but if you steal from the rich and keep it, what are you?
Can you name the four, I see them in here, and I probably should know them off the top of my head, but the four HMOs that are...
They are Medicaid, Blue Cross Blue Shield, UCare, and Health Partners.
Okay.
And those are the four that administer Medicaid in Minnesota.
Yep, okay.
Yep.
And we're talking about a number of state employees. Would that be individuals, departments?
Especially in the Department of Human Services, which oversees the program.
Okay, how far back would that go?
David?
There are only, as near as I can determine, a handful of employees at the Department of Human Services who understand the entire breadth and scope of the Medicaid program operation. It's a very closely held secret. The exact mechanism of how we draw federal matching funds is probably more closely guarded than the recipe for Coca-Cola. And so it is among these employees where the knowledge occurs, and And of course, in 2010, one of these employees at a conference call, for reasons that only the employee could explain, basically spilled the beans and said, here's what we're doing. We're adjusting the reserve requirements so that if a program has a federal match, we're cranking them up to the max. And if a program is state-only funded, we're making them zero. You can't do that. And that explains, that simple explanation explains all the anomalies that we've observed all these years. It also explains the intense secrecy that surrounds the operation of these programs. Why no provider has ever been able to figure out how the rates are certified or what goes into them. And while providers don't understand, and this is probably the real travesty, we're blaming hospitals and doctors and chiropractors, and podiatrists and dentists for the ever-increasing cost of health care. But what if they're not the reason for the ever-increasing cost? What if the real cost driver here is the HMO brokers that we've outsourced these programs to? And that's something that this audit will also dispel or confirm. So that's part of the problem, but like any audit, at the end of the day, once it's done, the state will be in a better position. Number one, it will have information about health care, which is essential to consumers. Number two, it will restore integrity and public trust in this program. And number three, we'll have a financial reckoning, because as I'm fond of pointing out, in Minnesota, we said the word audit, and we got $103 million back in the last 2 years. What would we get if we did?
I have a question.
Yes.
Over the past couple of years, hi, I'm Deb Solomon from Fairfield, Minnesota, and I have a question. Over the past couple of years, they've been cutting services to the poor, the health care. How many people, it outrages me, how many people were cut that could have been covered under services when they were padding their pockets? If the regular citizen is not outraged, then I want to ask why they're not outraged. This is a big issue, and, you know, like you said, it's broad, and I think that it needs to be dealt with.
Well, just in terms of numbers, I'm a numbers guy. I think you want to know that the Medicaid program in Minnesota is receiving from the state government and the federal government over $4,000 per year per person served. And that, especially when you consider that the reimbursement rates are very low, that should be enough to meet the needs of those who need Medicaid services. But any detail on that, I'd ask for David to supply.
If you go online and look at the esteemed Kaiser Family Foundation statistics, you will see that in fact Minnesota's per enrollee payments to the HMOs are among the highest in the country, but Minnesota's payments to providers are among the lowest. There is no way to reconcile that paradox except to confront the reality the middleman is pocketing the difference. And so, to answer your question directly, if there's a 25% administrative and profit that's being skimmed from these programs, and our current program is $4 billion a year, that means $1 billion a year is being wasted. How many more people could receive health care for $1 billion a year in Minnesota? Or what if our budget woes, if your bent is fiscal conservatism, could be addressed? Because right now, the ironic part is we're enriching not-for-profit corporations that don't even pay shareholders dividends. No one in this room could even buy a share of stock in these entities and somehow indirectly profit from what's going on. It's hoarding money for the sake of hoarding money while people suffer from lack of access to health care.